Oh Lord, I've just come from the fountain, just from the fountain.
The aim of Dr. Rosenhan's study was to test the hypothesis that psychiatrists cannot reliably tell the difference between people who are sane and those who are insane. The study consists of two parts. In the first part, 8 sane people attempted to gain admission in 12 different hospitals. All of the pseudo-patients complained of the same symptom, an unfamiliar voice in their head saying the words, empty, hollow, and thud. After admitted into the psychiatric ward with a diagnosis of schizophrenia, the pseudo-patients stopped showing any signs of abnormality. When asked how they were feeling by staff, they said they were fine and no longer experienced symptoms. Each pseudo-patient had been told they would have to get out by their own devices by convincing staff they were sane.
Nothing's wrong with me.
The pseudo-patients spent time writing notes about their observations. Initially, this was done secretly, although as it became clear that no one was bothered, the note-taking was done more openly. The patients flushed their prescribed antipsychotic medicines down the toilet. None of the pseudo-patients were detected, and all but one were admitted with the diagnosis of schizophrenia and were eventually discharged with the diagnosis of schizophrenia in remission. The pseudo-patients remained in the hospital for 7 to 52 days, on average 19 days. Although they were not detected by the staff, many of the other patients suspected their sanity. 35 out of the 118 patients voiced their suspicions. Even though other patients could tell they were not insane, no doctors or staff ever detected them. From this part of the study, Dr. Rosenhan concluded that there was an overwhelming sense of dehumanization and severe invasion of privacy in psychiatric wards.
Hi, Dr. Rosenhan. This is Dr. Morgan. I would like to tell you.
In the second study, staff of a research hospital that were aware of the first study were falsely informed that during the next 3 months, 1 or more pseudo-patients would attempt to be admitted into their hospital. They were asked to identify those pseudo-patients. The hospital reported that their staff suspected that 41 out of 193 patients were pseudo-patients instead of real patients. No pseudo-patients were actually sent.
We didn't send any patients.
Rosenhan claims that this experiment demonstrates that psychiatrists cannot reliably tell the difference between the sane and the insane. He suggests instead of labeling people as insane, we should focus on individual specific problems and behaviors.